wealth of information out there on the internet that's available to you now, and I often find that people get very confused with this minefield of information. One of the most basic things people get confused about is the different techniques that we use in transplantation. Often other clinics label these procedures with different names or give them different titles, and it often leaves people quite confused. There's only two different ways of doing the transplant procedure, and that's either with FUT or FUE. FUT, you may have seen this written as the strip technique. This is the most widely used method in transplantation today. During an FUT procedure, a very narrow strip of skin is removed from the back of the head, and this contains the grafts that we use for the transplant. With FUT, we can move the most amount of hair for you in the shortest amount of time, and that obviously has a big advantage. And we also don't have to touch the rest of your existing hair. We're working on the area of the size of the strip only, so it's isolated to this area. FUE is the second method. It's a newer method. To harvest hair with FUE, we individually punch out the hair from the donor area. We have to work over a much larger area to extract the hair, and it's a much lengthier process. So this is the main restriction with FUE. If you are looking for a higher graft number, you need to realise that you will probably have to go into a second session to achieve that graft number. Another common question that people often ask is, will anyone be able to tell I've had this done? Will it show? And this really depends on the type of technique that's been used, and also on your own existing hair to a large extent. With FUT, the work that we've done, both in the donor and the recipient area, can usually be covered by your own hair. With FUE, because we need to shave the head for this particular technique, you have to remember that you will always be more exposed post-op. People often mistakenly believe that the hair that we transplant is going to fall out again at some stage, or they will lose it again. The hair that we transplant is permanent hair which comes from the donor area. It's resistant to the DHT hormone, which attacks the hair on the top and the front of your head typically. As such, when we move this hair to a new area, it's permanent hair. It will grow and keep on growing for the rest of your life. Part of the consultation is obviously deciding whether this is the right time for you to do the procedure, and if it's not, we will tell you if you're not suitable for treatment. People often sometimes think that the procedure will give them instant results or instant hair. The reality is you're looking at a time frame overall of about 9 to 12 months to get to the end result. The majority of patients, the first hair comes through at about 3 to 4 months. At 6 months, the majority of the hair has usually pushed through at that time. And then from 6 to 9 months, the hair will increase in length and density, leading up to the 12-month stage, which is the final result. We pride ourselves not just on the quality of the work that we do and the results we produce, but also on a very high level of contact with you right the way through this journey. With Vinci Hair Clinic, you have the choice of having the procedure performed either at our London Harley Street clinic, or at our clinics in Spain, or our clinic in the capital, Madrid. Lots of people get daunted by the thought of coming abroad for the procedure. But the reality is this is a very straightforward process. Your itinerary is organised for you, and I'm with you through every part of this process to ensure that your experience runs as smoothly as possible. If you'd like to find out more about Vinci Hair Clinics and the procedures that we offer, you can visit our website, and there you'll be able to fill in a contact form or one of the more in-depth online consultation forms. You can send us your photos for evaluation, or you can just call us directly. We look forward to hearing from you.